Good day! I'm Camille M. Macanilaw, third-year student nurse from Nueva Ecija University of Science and Technology. And for today's return demonstration, I will demonstrate nasogastric tube feeding. For the assessment, check doctor's order. Check client's level of consciousness and level of knowledge and understanding. Assess availability and functionality of the needed materials. Check for any clinical signs of malnutrition or dehydration. Check for allergies to any food in the feeding. If the client is lactose intolerant, check the tube feeding formula. Notify the primary care provider if any incompatibilities exist. And for the planning, before commencing a tube feeding, determine the type, amount, and frequency of feedings and tolerance of previous feedings. Now, prepare equipment. The correct type and amount of feeding solution. 60 ml catheter tip syringe. A mesh basin. Clean gloves. pH test strip or meter, which is improvised. Large syringe or calibrated plastic feeding bag with label and tubing that can be attached to the feeding tube or pre-filled bottle with a drip chamber, tubing, and a flow regulator clamp. Measuring container from which to pour the feeding. If using an open system, water, 60 ml unless otherwise specified at room temperature, and feeding pump as required. And for the implementation, prior to performing the procedure or the feeding, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do and why it is necessary. Good morning, ma'am. I'm Camille M. Macanilaw, your student nurse from Nueva Ecija University of Science and Technology. And I will be your student nurse from 7 a.m. to 3 p.m. Ma'am, can you state your name?
I am Jenny Mercado.
And your birthday?
January 4, 1999.
Ma'am, can you say your name band? Ma'am, the procedure we will be doing is nasogastric tube feeding. Ma'am, you need to cooperate with this kind of procedure so that it will maintain your nutrition while you have an underlying condition. Is that okay, ma'am? Ma'am, before we start the procedure, I would like to inform you that you will feel fullness rather than discomfort. Okay, are you ready? Okay. Let's start. Ma'am, I will just position you in a high Fowler's position or upright sitting position. Next, perform hand hygiene and observe appropriate infection control procedures. Then provide privacy for this procedure if the client desires it. Tube feedings are embarrassing to some people. Assess tube placement. Apply clean gloves. Attach the syringe to the open end of the tube and aspirate. Check the pH. Allow 1 hour to elapse before testing the pH if the client has received a medication. Use a pH meter rather than pH paper if the client is receiving a continuous feeding. Follow agency policy if the pH is equal to or greater than 6. Assess residual feeding contents. If the tube is placed in the stomach, aspirate all contents and measure the amount before administering the feeding. Administer the feeding. Before administering feeding, check the expiration date of the feeding. Warm the feeding to room temperature. Rationale, an excessively cold feeding may cause abdominal cramps. Clamp the feeding tube. Clamp the feeding tube before all of the water is instilled. Rationale, clamping prevents air from entering the tube. Ensure client comfort and safety. Secure the tubing to the client's gown. Rationale, this minimizes pulling of the tube, thus preventing discomfort and dislodgement. Ask the client to remain sitting upright in Fowler's position or in a slightly elevated right lateral position for at least 30 minutes. Rationale, these positions facilitate digestion and movement of the feeding from the stomach along the alimentary tract and prevent the potential aspiration of the feeding into the lungs. Ma'am, just stay in that position for 30 minutes, okay? And for the evaluation, evaluate the patient's response to the procedure and document the procedure and other important data on the client's chart.
Thank you for watching.